Good afternoon. I'm Dr. Joss Reimer, medical lead for the Vaccine Implementation Task Force. Today, we have reached an incredible milestone in the vaccine campaign. As of today, more than 2 million doses of vaccine have been administered to people in Manitoba. This has been a monumental effort, spanning from when the first dose was given back on, I think it was December 16th, 2020. But we're not done yet. So from all of us on the vaccine task force, thank you. There have been thousands of people involved in this campaign, and we couldn't have done it without you. I also want to thank everyone who may be watching who's chosen to get the vaccine so far. This is really your story. It's built around your decision to protect yourself, protect your loved ones, and protect our province. I also want to congratulate the winners of our second round of Vax to Win lottery, who were announced yesterday. Thank you to them as well for rolling up their sleeves for a second time. So today, we're announcing additional recommendations for third doses. So the first recommendation is for people who have only received a viral vector vaccine. So that means people who have received 2 doses of AstraZeneca or a single dose of Janseen, also known as Johnson & Johnson. AstraZeneca provides a high level of protection initially, especially if the 2 doses are further spread out. But over time, studies are showing us that the level of protection from AstraZeneca appears to decrease faster than with the mRNA vaccines. So this is why we want to make this option available to people. The Janseen vaccine, because it's 1 dose, starts with a lower level of protection in the first place, but they have released some early data from the manufacturer showing that a second dose increases that protection substantially. So these individuals can be immunized without a prescription at any location that is currently offering COVID vaccines. To be clear though, the next dose should be mRNA, and should be given at least 6 months after their last dose. So today we are also, with Shared Health, recommending a third dose for all healthcare workers, including volunteers who have direct contact with patients, residents, or clients. This also includes all First Nations healthcare workers, including traditional healers and knowledge keepers. For many healthcare workers, it has been quite a few months since their last dose of the vaccine. We've seen some reassuring data from the UK showing that protection against severe outcomes for healthy individuals lasts for at least 20 weeks in that study, and another study coming out of California showed similar protection against severe outcomes lasting at least 6 months. However, both of those studies showed that protection against mild infection does decrease over time. And in general, if we weren't inside of a pandemic, we might be okay with a lower level of protection against mild infection. But when we are facing a 4th wave, and we do know that every healthcare worker is critical to being able to provide services to Manitobans, we want to offer this booster to use every tool in the toolbox to support the healthcare system. So this is a booster shot. It will help to ensure the strongest defense possible for Manitoba's healthcare workers, even against mild infection. Healthcare personnel can receive their third dose without a prescription at any clinic or site where the COVID-19 vaccine is offered, including some of the upcoming occupational health clinics. Again, we are recommending that this third dose be given at least 6 months after their second dose. That is, of course, unless they meet other criteria for third dose, such as being immunocompromised. Additional information about the staff immunization clinics and access to third doses through occupational health will be shared by the service delivery organizations in the coming weeks. I also want to make it very clear that receiving a third dose or a booster dose is voluntary. Healthcare personnel who do not receive this third dose are still considered to be fully immunized, and this is not a part of the requirements for testing or immunization. And finally, I would like to update on the process for requesting a medical exemption from the COVID-19 vaccine. We have the list of criteria on our website, and those have not changed, but I will run through them quickly for clarity. There are 3 situations where an exemption might be considered. Those include if someone had a severe reaction after the first dose of a COVID-19 vaccine, such as myocarditis or Guillain-Barré syndrome, if they are receiving treatment that affects their ability to mount an immune response. So this might include treatment after a transplant or certain types of cancer treatments where the vaccine needs to be delayed until their immune system recovers. Or if they've had a severe allergy, such as anaphylaxis, to a previous dose of a COVID-19 vaccine where the allergy can't be managed by our clinic. So the first step, if you believe you meet one of these criteria, is to meet with your regular healthcare provider. If you already have a relationship with a specialist, that could be your specialist. If the healthcare provider determines that you meet the criteria, you'll then be referred to a specialist for further assessment of this condition. If the specialist agrees, they will submit the exemption to Manitoba Health and Seniors Care. And only licensed specialists can submit that to us. There is a secure way for them to share it with us, and that information is only provided to the specialists who are able to do that. Once that is received by the province, we enter the information into our provincial immunization database. And that includes information about whether the exemption is permanent or temporary. And this means that exempt people will then be able to request a digital or physical Manitoba immunization card about 7 to 14 business days after the request is submitted to Manitoba Health and Seniors Care. So when these individuals get their card, it will appear the same as any other immunization card. When it's scanned, the QR code will be identical to those currently used by fully immunized people. This will help protect the private health information while also keeping a simple, consistent process for venues and events that must validate immunization status. We expect there will be a limited number of people who will be exempt from requiring the vaccine, but this process will ensure they're able to register their status and obtain an immunization card. To be clear, if you do receive a medical exemption, you will be able to access the same venues and events as fully vaccinated people in Manitoba. However, you should have a conversation with your healthcare provider about whether these situations are safe for you, given your medical condition or related treatments. In closing, I just want to say thank you again to the hundreds of thousands of Manitobans who have been immunized and who continue to be immunized against the virus. And with that, we can go to questions.
Starting in the room?
Okay, go ahead.
Okay. So NACI hasn't yet recommended third doses for the populations that have been announced today. Why is Manitoba moving ahead?
Yeah, so this came from discussions with Shared Health and concerns that they had around what might happen in the fourth wave, particularly if staff were to become ill, even with mild infections. And so as we've seen to the west, some of the strains that have occurred with the fourth wave, and as we experienced in the third wave, it was important for Shared Health to use every single tool available to them to improve the healthcare capacity to be able to provide services to Manitobans. So while most healthcare workers are not at high risk of severe outcomes, we wanted to protect them even against milder infection to help keep them able to care for all of us as Manitobans.
In our data for breakthrough infections, are you seeing more or like a greater proportion among healthcare workers? Is that part of this decision today?
So I don't have any of the numbers in front of me, but we have seen somewhat higher rates in healthcare workers compared to the general population. But I would have to look to see if we have any official numbers that we can share.
And do you think that's because of exposure and like environment, or is it because of length of time since they were eligible for their first round of shots?
So we haven't seen necessarily that the rates of infections in healthcare workers increasing over time. I just know that the rates are a bit higher overall than the general population. And so we think that that could be due to exposures as they're caring for people who are known to be infectious. But also they're more likely to go for testing as well. And so we're more likely to know about infections in healthcare workers because they're more likely to seek care.
Dr. Reimer, is for the people who got AstraZeneca or Johnson & Johnson, is the third dose mandatory, or is this an option to be considered fully vaccinated?
So right now we're not changing our definition of fully vaccinated for anyone. We're having conversations specifically about Janseen because the protection was so much lower, but whether or not we might change that in the future. But for today, it's a recommendation, it's not a requirement, and it doesn't change anybody's status as fully vaccinated.
Do you know how many people would be included in this booster shot expansion, including the viral vector and the healthcare workers?
Yeah, there's just under 7,000 people who got viral vector vaccines, with almost all of them being AstraZeneca, as we didn't offer Janseen here. We have about 450 people who have submitted proof of Janseen immunization to us. Out of that, just under 7,000. And there's somewhere around 50,000 healthcare workers, but I don't have exact numbers for how many would be frontline, how many of them would be critical to service and would be recommended under this to get the third dose.
Dr. Reimer, what's the next group you'd be considering for third dose shots?
Yeah, so we're talking now about people based on age. The UK data showed that those who are over 80 might see some decreased protection against severe outcomes over time. They didn't tease out personal care home residents, so it's hard to know if it truly represents everyone over 80 or if the fact that personal care home residents were in there just made the whole group look higher risk. But by age would definitely be one of the things that we're looking at, as well as people who are at other types of congregate living, like assisted living.
For people who aren't included in this and are maybe kind of getting close to that 6-month mark and concerned about waning effectiveness, what would you want to say to them?
So I'd say a few things. The first is that if you're healthy, the UK data and then 2 days ago a study out of California showed that protection against hospitalization and death stayed above 90%. So it's very effective at the really important outcomes that we want to prevent. So even if the likelihood of having cold-like symptoms goes up, you're very unlikely to end up with a severe illness. And the other thing is that, say, compared to the California study, for many people in Manitoba, their 2 doses were spread out quite a bit more than they were in the United States, where they got them at the 21 days. And we have seen that the further spread of doses improves protection further. So in Canada, we might actually see better protection than what we see in the American data.
We've seen people in the past using doctor's notes or different immunization cards to say they don't have to get the vaccine. Is keeping them as a singular card part of streamlining the process for Manitobans or shop owners to know that there is no other card? You will only ever see one card?
Absolutely. So we had lots of conversations about how many people have to scan those cards in so many different sectors, and we wanted to make it as simple as possible for all of them because we can't have engagement with every single host at a restaurant and every single person who's at the door at a museum. And so we wanted to find a way that made it as simple as possible for everyone. So the message is clear that this is the only proof of vaccination, regardless of whether or not somebody's medically exempt. So coming in with a doctor's note to a restaurant would not be sufficient. They need that card with a scannable QR code. And we do also really encourage people to scan the code. That's the card itself is great, but scanning the code makes sure that it's valid, that it came from us, and because some of these may be temporary, scanning it lets you know that they're still exempt.
Because there's so many
One more question, then we'll go to the phone.
freedoms that are being given to people who have the vaccine versus those who don't, I can imagine people who are medically exempt will want to expedite this experience, meeting a doctor, then being referred to a specialist, and having it sent in to the government. What's the timeline that a person will be looking at to get the card?
So most people who will be eligible already have a relationship with a specialist because they're receiving specialized care. So for example, if they're receiving chemotherapy for cancer. So for most people, they'll already have that relationship and their specialist can submit their exemption to us immediately, and then it'll just take some processing time for us to get that into the VaxCard system. So we're asking people to wait 7 to 14 business days from when the specialist lets us know about the exemption to get all of those steps done. For those who don't have an existing relationship with a specialist, then there will be a bit of a delay as they get referred on. But even there, most of the rest of the individuals are those who had a severe reaction after dose 1, whether it's allergy or something else. And many of them have already had a form submitted to public health to review that event. So we may be aware of them and able to expedite a bit quicker if they did have a severe reaction.
Okay, thank you. We'll go to the phone.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Sun, James.
Yeah, good afternoon, Dr. Reimer. Are you recommending the booster shot for international travel?
So we don't recommend a booster shot for international travel. What we did instead is just make a third dose available for travelers where they are not allowed to go to certain destinations because that destination doesn't recognize what they received here. So there's no health recommendation saying that if you're going to travel, you need a booster shot or you're at high risk and therefore should get a third dose. This really was just about Manitobans not being disadvantaged when they're traveling. So for the travel, it's really people who have a confirmed trip going to a destination that requires a different schedule than what they received.
Okay, thanks. Just on another topic, how do you respond to community members who are afraid there'll be no end to the pandemic and vaccines?
Yeah, I mean, that's a bit of our experience with other viruses as well. So we have an influenza or a flu season every year, and people have to get a booster shot every year. So that's certainly a possibility here as well, that this might become something we have to do every year. But as more and more of us become protected and the severity of infections goes down, we'll become more and more like how we treat influenza. And so even as people get infections, those who don't end up in the hospital, those who don't die, will also slowly have more and more protection as well, even without the vaccine. So as a society together, we will see decreasing severe outcomes and therefore be able to move away from all of this emergency approach to managing the pandemic.
From CBC Radio Canada, Jeremy.
Hello, doctor. Can I ask you one question in French or you prefer in English?
I prefer in English. It's hard to hear, sorry.
Perfect. So can we expect to ask everybody in the province to have a third dose like over the next few weeks or few months, or do you think that it can be the case, and if so, when?
So I think that's a great question because this is not urgent the way dose 1 and dose 2 were. People who have had 2 doses have protection. We have seen that some people will have lower levels over time, but most people are still well protected. So we're not saying that healthcare workers or people who've received 2 doses of AstraZeneca should drop everything and get their dose tomorrow. This is really something that people can do over the next weeks as they get further and further away from their second dose. So we are continuing to focus on moving away from all of these special super sites, mass clinics, and moving towards our usual way of offering immunization, where it's with physicians, with pharmacies, and public health run clinics. So even with the third dose, that focus is still going to be slowly moving back to our more regular, with some enhancements, way of offering immunizations to Manitobans. And so we don't see this as the need for the 35,000 doses we had in a day at our peak in this campaign.
And you don't have any more questions?
From CBC Manitoba, Bart.
Hi, Dr. Reimer. Yesterday, between yesterday and today, when you got over 2 million doses there was a jump of 10,000 doses recorded in one day. Over the past few weeks, you've been doing an average of more like 2,000 doses a day. Why the big jump, 10,000 this time?
Yeah, so I know that there was some just correction with the bulletin, and so there was some, just the way that they were reporting it, I think, differed. So there was no actual jump in the number that were administered. It just had to do with making sure that we were reporting from a consistent source. So I'm sure that the communications team or the EPI team can give a better description of exactly why the number changed, but there was no difference in the actual number that were administered. It just reflected the way that it was reported out.
Okay then. A lot of questions about the travel purposes for people who got 2 AZ doses. A lot of people, if they get a third dose for travel purposes, they still end up with a cocktail, which is not sufficient for some people. Will you be authorizing, province, authorizing, I can't believe we've been asking this, 4th doses for people who got 2 AZs?
Yeah, so and I appreciate that you're saying authorizing instead of recommending, but like the third dose for travel, there's really no clinical recommendation for a 4th dose either. And the more doses you get, the more the risk to benefit ratio shifts towards risk. So, we're still saying, have that individual conversation with your physician, and make sure that you understand that just from a strictly clinical COVID risk, that there's no benefit to getting a 4th dose, but you could be at risk, while it's still small, of having a severe outcome from the vaccine. And so if together, the physician and the individual review those risks and benefits and decide to go ahead with the 4th dose in order to travel, we're not getting involved at the provincial level with that interaction between the physician and their patient.
From CJOB, Clay.
Good afternoon, Dr. Reimer. I think a lot of people are still concerned when they see when the COVID-19 cases come out Monday to Friday, that fully vaccinated people are still coming down with COVID-19. Any comment on that?
Well, as the number of fully vaccinated people goes up in Manitoba, the proportion of cases in fully vaccinated people, that will also go up. If 100% of Manitobans were fully vaccinated, then 100% of our cases would be in fully vaccinated people. So just looking at how many fully vaccinated cases there are doesn't give a clear picture when, in Winnipeg, 90% of the eligible population is vaccinated. So, we really encourage people to consider the bigger picture, and also consider that when we look at hospitalizations, that number goes down. And when we look at ICU admissions, there's almost no one who is fully vaccinated who ends up admitted to ICU. We've really only had a handful of people fully vaccinated ending up in the ICU, and most of them had some pretty severe reasons that the vaccine may not have been as effective for them. So this vaccine is incredibly effective. It's been remarkable to see in our personal care homes the just complete drop in outbreaks, and just seeing how overwhelmingly higher the risk is if you're unvaccinated to end up in the hospital, to end up in the ICU. So while this vaccine is not perfect, no vaccine prevents infection 100% of the time, it is dramatic. And so I encourage people that even though it doesn't take you down to 0, it takes you pretty close to 0 when it comes to ICU admissions, and it takes you way, way lower in your risk, even for mild infection.
Okay, just a quick follow-up, if I may. We've had some inquiries. Would paramedics be considered on the list for the healthcare workers who could be eligible to get a 3rd booster shot?
Yeah, so we're not so much trying to break it down by individual job types, and more just saying, if you're a critical worker in the healthcare system and you have direct care with patients, whether that's in the ambulance, in the emergency room, on the ward, in a personal care home, That's really who we're focusing on. So a paramedic who is taking people to the emergency room and treating them there as they hand over to the staff there would be an example of someone we would recommend a third dose for.
We now return to the news conference theater.
I was wondering if you could describe the evidence about AstraZeneca and waning protection. Is it in fact waning protection, or is it difference in the level of protection to begin with?
So the best evidence we have comes from the one UK study, because they compared AstraZeneca to Pfizer, and they have a more similar rollout to ours, and looked at cases, looked at hospitalizations and deaths over a 20-week period. They saw that initially in that study, AstraZeneca had a bit of a lower protection, but it was still very high. But what was more apparent was that while Pfizer really didn't drop at all when it came to mild infections in healthy individuals, AstraZeneca did. And so over those 20 weeks, we did see, even in mild infections, a drop in healthy individuals. And when we looked at people with higher risks, or we looked at severe outcomes, if we looked at people with higher risks, we saw more dramatic drops as well. So AstraZeneca was, unlike Pfizer, did have a drop even in healthy individuals, preventing mild infection, and had a much bigger drop in people who had higher risk for severe outcomes.
Further to the flu shot, do you have any indication on when that campaign might start?
Can you clarify that question?
When would you start making the flu shot eligible to Manitoba?
So the flu shot has already been sent to all of the personal care homes in Manitoba. Occupational health in some areas already is offering clinics, and some of our physicians and pharmacies have received doses as well. That the rollout has begun. What we're trying to work on now is the logistics of, in occupational health clinics, for example, offering both a booster dose and the flu vaccine at the same time to staff. And that's where we're working with Shared Health to get more details on how that rollout's going to look for healthcare workers.
For third doses for people who got a mix of AstraZeneca and an mRNA vaccine, can you just describe the difference as to why they're not part of this third dose eligibility?
Sorry, can you say that one more time?
For folks who got AstraZeneca and either Pfizer or Moderna, why aren't they getting a third dose as well?
Yeah, so in the study that made us more concerned about AstraZeneca, it was people who got 2 doses of AstraZeneca. The immune response in other studies, when you get a mixture of mRNA with a viral vector, was very high, and at least as high as getting 2 mRNA doses. So while that study didn't look specifically at the mixed dose, we have no reason to believe that people with the mixed dose would end up similar to those who have 2 doses of AstraZeneca. The evidence in front of us would lead us to believe that they would be more similar to 2 doses of mRNA in their protection, just because of the level of immune response that they receive initially.
So when looking at the UK and the California studies, there's a drop in protection against mild infections after 6 months, correct?
It was 6 months in the California study and 20 weeks in the UK study.
Is there any change in those studies for the protection against severe illness? You said it's, I think, largely unchanged, still robust, but is there any weakening of protection? Because that seems to be one of the, the most important thing is mitigating severe illness.
Yeah, with the California study, I haven't had a chance to go through it in detail. It's only released 2 days ago. But the UK study, I have gone through quite a bit. If people were elderly and had health conditions and had their 2 doses close together, they did see a drop in protection against severe outcomes. And that's why we started with our personal care homes recommending a booster dose, because most of people in personal care homes meet all of those. Most are elderly, most have other health conditions, and most of them got their 2 doses very close together. So that was where it was the most substantial drop was in people who had multiple risks. What they called it is clinically extremely vulnerable was the term they used in the study.
So when we see a drop in efficacy for mild symptoms, does that mean that you can be more likely to just be infected, period? And if so, does that mean that the virus can spread more within the community? Because that would be the other benefit of being vaccinated, protecting against severe illness for yourself, but then also reducing the likelihood that you're transmitting the virus to others.
Yeah, and they didn't look specifically at infectiousness in these studies or how likely someone was to have an asymptomatic infection, for example. But that's certainly something we're worried about. So if mild infection becomes more likely, 6 months after a second dose, we're certainly concerned that that might mean that your chance of transmitting it also goes up, even if the study didn't look at that specifically. And that's also why healthcare workers were a group that we wanted to target, because they're taking care of people who are already ill, already at high risk of severe outcomes. And so we don't want our healthcare workers to be the one transmitting the virus to them, believing that they're protected with the 2 doses.
So knowing all that, the likelihood that everyone's going to need a 3rd dose is pretty much a foregone conclusion. And if so, what kind of a timeline are we looking at? Would you say that within the next 3 or 4 months, or pick a timeline? Pretty much everyone who's had their 2 doses will likely be, there'll be a recommendation for a 3rd.
Yeah, I think it's likely that at some point we'll recommend a 3rd dose for most people. I would say that's still not a guarantee. It really does depend on what we see with severe outcomes, because we're not doing all of these public health orders to prevent mild illness. And if we are able to protect enough people that the healthcare system can keep up, and we're not putting people at additional risk with an overburdened ICU, that does change our approach somewhat, because we don't have such an aggressive approach with influenza, for example. So I think it's likely that at some point we will offer 3rd doses more broadly. If I were to guess, I think it would be before the end of the calendar year. But there's still a lot of factors at play that would push us more one way or the other on that.
So likely that most people will need a 3rd dose by the end of the calendar year?
Again, there's so many factors. So I think based on what we're seeing so far, there's a good chance that we'll recommend a 3rd dose for most people this calendar year. But I don't want people to be worried that they're not well protected, because really the studies have shown that when we're talking about hospitalization and death, that these vaccines are extremely effective and that protection lasts for a long time.
Are you able to describe how sick a fully vaccinated person will get with COVID, especially based on what we've seen in Manitoba so far? Like, what's the typical symptoms and length of symptoms?
Well, most people who are vaccinated and get infected experience like a cold. So they feel unwell for a few days and have a sore throat, maybe a fever. Many of them have very little symptoms at all. The good news is that almost none of them go into hospital, and very close to 0 end up in the ICU. So it's very encouraging to see how well this vaccine continues to work against the severe outcomes.
Just wondering, like, the 3rd dose for especially young people, so say healthcare workers 30 years of age or younger, is there concerns for like myocarditis or any of those other side effects that we've seen in the younger population?
Yeah, that's one of the reasons we're not just jumping forward and recommending 3rd doses across the board, is that we know that while the risks associated with the vaccine are very low, they're not 0. And so we don't want to offer a medical intervention to somebody unless we feel confident that the benefits outweigh the risks. So if you're working in a healthcare setting where you may be exposed to the virus, where your work is critical to the care of people around you, it's a different risk-benefit discussion than somebody who's healthy and not working in healthcare, not being exposed to the virus on a regular basis. So, we have seen increased risk around myocarditis, specifically in young men. And so we take that seriously. And we don't want to see unnecessary cases of myocarditis, even though the myocarditis associated with the vaccine has been mild for almost everyone.
We'll do last question.
The booster application for Moderna, I think it's a half dose compared to what we've seen for the regular vaccination regime. So what are you telling people about the third dose? Are they getting a Moderna? Are they getting a Pfizer? Are they getting half a Moderna? What's the situation?
Yeah, for now we're recommending that they stick with the same product that they've received so far. And for most people, they got 2 of the same dose, so we would recommend sticking with that product again for the third dose. Well, we know that Moderna is developing a half dose for their booster. They haven't finalized that. We haven't seen the data on it, so we just don't have enough to make that different recommendation at this point. But certainly if that changes, if they submit to Health Canada, if we're able to see that a half dose is very protective and hopefully has lower risks, we would move to that in the future.
All right, thank you, everybody.
Thanks.